Ozempic Face. I know you've heard about it, but what is it? In order to understand Ozempic Face, let's take a step back and explain what Ozempic is. Ozempic is an injectable medication that's used to treat diabetes. What they found is that while it's very effective in treating type 2 diabetes, one of the side effects is weight loss. So naturally, people are using this medication in order to lose weight. So people who are not diabetics, who just are normal people that just want to lose weight, are now getting prescriptions for Ozempic. They may also be getting something called Wegovy, which is the same thing just under a different name, or the generic version called Semaglutide. So what's happening is these people are getting this medication and they're losing a lot of weight. And the weight loss occurs all over their body, but it also occurs in their face. And that's why the term Ozempic Face came around. Ozempic Face really refers to loss of facial volume in the face, which gives you a sunken or gaunt appearance and basically makes you look more aged. People don't like it. Now, Ozempic Face, while it's a cute name and it kind of catches the headlines and gets everyone's attention, it's not unique to Ozempic. Basically, anyone that loses weight will lose fat from their face and they can get this appearance. That could be sunken cheeks, maybe some hollowing of the temples. Their face just looks thinner and longer, and like I said, it's just a more aged appearance. So if you lose weight through diet and exercise and you lose a lot of weight and you lose it quickly, you're also likely to have these features of Ozempic Face. So what's the treatment for Ozempic Face? Well, naturally, the treatment would be add some volume back to the face. You may say, just gain some weight back. And that's a reasonable thing to say. However, as you guys probably know, just because you lost fat from a certain place when you lost weight, and then if you gain weight, that fat doesn't necessarily go back to that place. We often see this on the opposite side. Like if you and I, we gain weight and the fat goes certain places, and then we get ourselves in gear and we diet and exercise and we lose that weight, that fat doesn't always go away. Sometimes it's stuck there. So it's the same thing with Ozempic Face. Just gaining weight isn't necessarily going to make those cheeks fuller. That's a situation where you may come in to see me as a plastic surgeon or somebody else as a dermatologist and say, hey doc, what can you do for my face? As I said, the treatment is to add volume back to your face in the place where you lost it. So commonly we'll use some sort of filler. So Restylane, Juvederm, Radiesse, Sculptra, there's a whole bunch of different fillers, and we'll actually inject it into those areas where you feel like you're hollowed out. So we will inject it into the cheeks to plump things up, inject it into the temple area where you get some hollowing, and basically replace the volume that was lost using this synthetic material. Filler in the face does really well. It's very predictable. It's very safe. It's not permanent though. So what are some other options? Another option might be using your body's own fat as a filler. This would involve taking fat from somewhere on your body, processing the fat, and then injecting it into those same areas, just like we would a synthetic filler, but using your body's own fat. This is appealing to some people because it's nothing artificial. It's their own body's fat. Some people do believe that it lasts longer. I think it probably does last longer than fillers, but it certainly is not permanent like some people will say. So just because you get fat injections, don't think that you're getting fat injections and it's going to last forever, because it won't. A third option for very extreme cases might be a facelift. A facelift will lift the skin of the face and make things look tighter, but it's not replacing the volume. So you have to be careful. If your problem is that you lost fat in your face, sometimes a facelift isn't the answer. So make sure when you see your board certified plastic surgeon or facial plastic surgeon, he or she evaluates you to make sure that a facelift is really the best option for you. But remember, although the term Ozempic Face is out there, it's not specific to Ozempic. It's really just referring to facial volume lost in anybody that loses weight. The more weight you lose and the faster you lose it, the more likely you are to have complaints of Ozempic Face. I'm Dr. Matthew Schulman. Hopefully you enjoyed this video. Make sure to check out the other videos on my page, and if you like what you see, make sure to like, comment, and share.